Introduction to Forensic Nursing, a new perspective in healthcare. Virginia Lynch, MSN RN Fellow, American Academy of Forensic Sciences President, International Association of Forensic Nurses, USA. As the practice of medicine becomes more sophisticated, it becomes necessary for hospital administration, physicians, and nurses to realize that the medical practice can no longer be restricted to treatment only. Emergency department physician, trauma care center handle a number of cases which involve legal problems also. Proper and complete management of such patients requires that the legal facets of their cases are handled with as much care as is exercised in treatment. While the various medical specialists do a fine job as far as treatment is concerned, a serious gap exists in attending to the legal facets in an equally satisfactory manner. This is an area where forensic nurse specialists can play a vital role. Their nursing background combined with a medico-legal education is ideally suitable for this purpose. Management of a victim of violence involves teamwork where nurses form an integral part. Physicians are normally tuned to treat patients. Most of them don't have special awarenesses of forensic requirement. Vital forensic evidence is frequently not collected, lost, or mishandled, resulting in miscarriage of justice. Healthcare providers who treat victims of violence have a responsibility to protect the patient's legal right also. Service of forensic nurses and other professionals with forensic knowledge would unquestionably go a long way to fulfill this need. Marching by the times, some institutions now provide facilities for the study and practice of forensic nursing through various programs such as internship in the medical examiner's office, critical care programs, and integrating forensic application, elective study in some universities. The basic aim is to utilize the untapped potential of nurses in the overall management, both medical and legal, of the diverse situation affecting various patients, which is the need of the day. While various areas where the expertise of the forensic nurse can be utilized with advantage would be delineated gradually, it is apparent that they are well suited to handle certain situations such as victims of trauma, domestic violence, sexual assault, drug abuse, handling certain cases of death investigation. Advantage of utilizing the expertise of forensic nurses specialists are many. As the forensic nurse will be collect and preserve evidence in emergency department and other situations, it will leave the physician free to attend to his and her medical duties without the anxiety of having to spend time in court. It will also ensure proper justice to the victim. The medico-legal evidence have been well carried out by the forensics trained also. About 2/3 of the medical examiner case load constitute natural death which do not need a high investigation profile. It can be handled by the forensic nurse with impunity, thus enabling the medical examiner to devote more attention to other cases where it is necessary. The Canadian experience indicates that the service of forensic nurse investigates youths the next of kin, hospitals, doctors, and medical examiner system supplement the role of police investigators, meet with the most problems of surveys on account of personal contact of the nursing investigator significantly reduces the resentment and stigmata of death investigation. This model of inquiry in sudden death cases is being adapted in progressive death investigation system in some countries. Investigating of a trauma. Emergency department nurses are routinely involved in the management of patients who are admitted for traumatic care. Injuries may be crime-related or self-inflicted. This case required that the nurse is specifically aware of the manner in which evidence should be collected and preserved and injury documented. Evidence. It is important to recognize and preserve trace evidence through careful handling of the patient's clothing and personal property. Clothing worn at the time of the incident may contain trace evidence, hair, fiber, paint chips, broken glasses, stains, blood semen that may link the assailant with the victim or crime scene. Careful observation of defect in a clothes may be compared to the victim's wound. This may provide a hint so as to the type of assault weapon. Some self-inflicted wounds may be confirmed by non-alignment of clothing damage with the injuries. In cases involving hit and run accident, tearing of the clothes, grease marks, road, dirt, glass particle, metal particle, paint fragment, etc. shall assist in reconstructing the event and even identifying the type of vehicle involved. In firearm death, the gunshot residues on the clothing may provide Vital evidence about the range of discharge, identified of the ammunition. Bullets found in clothing or bandage are removed from the body need to be carefully handled. They may show markings which may help to identify the firearm from which it was fired. It is important to wrap the bullet with the cotton to prevent a rattling and place each bullet in a separate container, preferably a clear plastic one, so that it is visible from outside, and the container sealed and labeled with the following information: victim's name, medical identification number, date and time of recovery, site of recovery, signature of medical officer who removed the bullet or the nurse who packed it, other information in relation to chain of custody. Clothing should never be discarded or thrown on the floor, as this can result in cross contamination or trace evidence with the debris from the treatment environment. If a victim can remove cloth, it should be done with the victim standing on a clean garbage sheet of paper. This will catch trace evidence that may be dislodged. Medical legal case, there should be a written order insert with instructions such as: hold the clothing for medical examiner, coroner, save clothing for the police, chain of custody for clothing, air dry clothing, hold as evidence. Evidence may be obscured by emergency trauma center. The original characteristic of the wound may change due to surgical extension, excision, or natural healing process. It is then not possible to reconstruct the original injury pattern. The only way to preserve this potential valuable evidence is: 2. Sketch the wound on body diagram or preferably photograph it prior to alteration. Record its location, measurement, document and alteration due to therapy. This is helpful to reconstruct the original injury pattern in subsequent investigation or at autopsy. If a bullet hole is scored during treatment, the initial appearances of the wound should be recorded and the cord tissue saved for gunshot residue analysis. The injury should be sketched or photographed prior to alteration. Any hair that may be shaved during treatment must be preserved. Rules of evidence require a chain of custody for each item recovered from the patient. This includes physical and trace evidence, laboratory specimens of blood and blood, body fluid, clothing, and personal articles. Every unexpected death has actual or potential medical legal aspect that must be recognized. While the best specimen for hospital use is the most recent one, the best for forensic purpose is usually for the first and the initial one. After hours or days of intensive therapy, it will be impossible to determine what the concentration of alcohol, carboxyhemoglobin, or drug was at the time of injury. Hence, although the hospital may not make use of specimen raw at the scene of injury, there is an obligation to retain it for the FSL or public prosecutor. Availability of proper specimen to decipher object data is necessary for the administration of justice. When criminal activity or accidental death is suspected, special forensic care is necessary to handle even the dead body. It should be left in the same condition as it was prior to death, with the tubing, catheter, and appliance in place till a forensic assessment is made. Thus, injuries can be distinguished from therapeutic alterations. Therapeutic needle puncture can be made by a pen to distinguish them from others which are not so. Cleaning of the body, packing of the body, orifices should not be done. The victim died of gunshot injury or sexual assault. Hand should be enclosed in a paper bag to protect any evidence such as gunshot residue or fragment of skin or hair beneath the fingernails. Documentation. Injuries should be described with a special reference to anatomical landmark and should be familiar with the appropriate terminology required to describe them. Sharp force injury. They include stab wound, incisive wound, blunt force injury, which result from assault, abuse, accidents, or resuscitation intervention. Abrasion, bruises, laceration, fracture, or blunt force injury resulting from impact of a blunt object against the body. Fast force injury. These are usually gunshot injury. Their understanding requires some knowledge of wound ballistics so as to recognize any particular pattern and document these injuries. It is necessary to understand the certain terms commonly used in their description, such as entrance wound, exit wound, shored exit wound, gunshot residue, stippling, abrasion wound. Dicing injuries. This usually resulted from motor vehicle accident. They are characterized right angle or V-shaped cutter caused by the dice or cubical fragment of tempered glass of a broken side or rear window being struck by or striking the victim. Bite mark injuries. Human bite marks are usually indicative of abuse, are generally associated with a sexual assault. Animal bite marks are usually accidental, but the owner may be liable if the animal is neglected, tortured, or trained into causing an injury, or if a dangerous animal, example, a tiger, escapes captivity by negligence or other illegal action. Pattern injuries. These are injuries to the pattern which reflects the identity of the nature of the wounding object. Defense wound. This usually indicates the posture of the victim against an attack. While they are most often found on the hand and arms, they may be located in any part of the body used to shield. They may either sharp or blunt depending upon the weapon used. Hesitation wound. These are usually sharp, force superficial wound made just prior to fatal injury or wound that may be in form of old superficial parallel scar on the wrist and neck, which are indicative of previous suicide attempt at a suicide. Domestic violence, abuse involving children, elderly patients, battered women is a universal problem that varies in quantity for any given society. Many victims of physical and emotional abuse or neglect do not even realize that they are victims. Often, it is the emergency department nurse who is the first to identify the victim as a victim. Forensic nursing emphasizes awareness of this crime. Nursing assessment in this area calls for attention to characteristic battering pattern, injuries to the face, neck, breast, abdominal pack, and genitalia. Also suspicious is any set of multiple injury by various parts of the body as well as injury during pregnancy. Adequate documentation is crucial in such cases. Sexual assault, sane and assault. Forensically trained nurses are being utilized in the United States for examination of victims of sexual assault. The primary responsibility of a sexual assault nurse examiner, same sexual assault nurse examiner, is to identify signs of physical and emotional trauma and to collect evidence. The nurse examiner performs a general physical or pelvic examination, paying particular attention to signs of minor trauma, aberration, contusion, laceration. Pelvic examination serves to document common findings such as introital tear, perineal erythema, perineal ecchymosis. Swabs and slides are made as required. Help of medical staff is utilized for the treatment of concomitant injury. Following the examination, the nurse examiner discusses prevention of possible pregnancy and STI. Wherever necessary, follow-up, appointment and consultation for or referral for crisis intervention of other agencies such as child protection, social services are arranged for the victim and her family. Based on the finding of examination, evidence collected, laboratory data and their interpretation, the nurse examiner testified in court as an expert witness and assess the administration of justice. The special organization which coordinates the service is known as Sexual Assault Resource Team. Implementation of this approach decreases the workload on the emergency physician, provides prosecutors with a greater accuracy of evidence, reduce emotional trauma of victim and her family, provides law enforcement official with a liaison who is knowledge of medical legal issue, ensures justice to the victim. Conclusion: forensic educated and trained nurse can be a critical opponent in the recognition and proper collection of forensic evidence in many situations with medical legal implications. With the emerging application of DNA profiling, virtually any scrape of genetic evidence such as blood, semen or tissue, and or used napkin at the scene may provide crucial answer to the identification and apprehension of the perpetrator of crime. Emergency department nurse can significantly aid law enforcement effort by retaining evidence, maintaining chain of custody, preventing changes in the physical condition of evidence, assuring significant testimony in court as she or he is the first to see the patient and the relative is first to handle property, first to collect, deal with the laboratory specimen, first to contact a potential source or obtain data necessary to determine the cause and manner of death. While the physician will provide necessary medical care, forensic nurse will assume the responsibility of legal care, thus filling a gap in the total care of the patient. Thank you.